Thank you. Thanks, Suzanne.
Kerry, would you be able to call Jo into the meeting? Because Jo's got the slide set, I think, has she, Liam?
No, she's here now.
You see her.
I'm here. I've been selected. Fantastic. All right, so just so everybody knows which session that you're in today. So the breakout room that you opted for was developing future nurses in primary care. So I'm going to hand over to the training hub and to Sam Howard and to Joanne Mellors and Liam Jenian. Sorry, Liam. Over to you.
I'll just share my screen and then we can start. Can everybody see that screen?
Yeah, thank you.
Perfect. So I'd just like to welcome you today. We've just refreshed our SSSA training and used it and updated it with the new guidelines since 2018. And it's just about encouraging clinical areas or within primary care to open up as clinical learning environments. So this training will be delivered, but then we will explain all the way through regarding what we do within Greater Manchester Training Hub and how we can support you and your practices out there to support learners in practice. So why are we here? So it's to become a clinical learning environment to support students. It is to help build our future workforce within primary care and to develop your current learning environment with to become a clinical learning environment. To provide opportunities for learners to master the professional role and specialism within primary care. To provide a rich and diverse learning environment that empowers learners to develop and embed critical thinking, and to support our future nurses within a fantastic general practice learning environment, embracing the key knowledge, skills and nursing role within primary care. Liam is going to just share a poll with you just to fill in. So if you don't mind, when he takes over the sharing part of this, just to fill in the poll, it'll pop up on screen and then you just answer the questions that you've got on screen. And then once we've got everybody filled in, then we can move on to the next bit.
Yeah, unfortunately, Joel, there's actually no option to do the Teams poll
Okay.
in this breakout room. However, we could just ask the questions. There's 3, and it's a yes, no, or I don't know. So if you could, using the chat box, just reply yes or no to the following questions. So the first one, is your practice a clinical learning environment? Is it yes, no, or you may not know? If you just use the chat box and answer that. Just give it 30 seconds and I'll just have to put a bit of a break in between so we know what the yeses and nos were for. Otherwise, it might all get merged into one. So is your practice a clinical learning environment? Yes, no, I don't know. Just wait for a few more. A lot of yeses. So I'll just pull a little break there. It works. There we go. Okay, so have you ever supported a learner on placements? Yes or no? So that question, have you ever supported a learner on placements? Yes or no? Okay, quite a lot of yeses, that's good to see. Just going to put another break in there. And then finally, in the future, do you see yourself supporting learners? So that question again, in the future, do you see yourself supporting learners? All right, thanks for that. Would have been a bit easier with the poll, but we managed it in the end. So back over to you, Joe.
Brilliant, thanks, Liam. So yeah, so just that was the main stage why we was here, and the main ideas behind why we were wanting to present at this forum. I will introduce myself first. So I'm Joanne Mellors, I'm a PEF and I work with Greater Manchester Training Hub. I cover Manchester, Stockport, Tameside and Glossop, and now I've just extended into Trafford as well. Sam is currently on here as well. She's a clinical lead. Sam, do you want to introduce yourself as well?
Thanks, Joe. Yeah, my name's Sam Howard. I'm one of the clinical leads. I cover the Bolton and Wigan locality, and I'm working really closely with Joanne as this piece of work stream. So I'm just sat in the background supporting Joe, really. Joe's doing all the heavy lifting with our savvy IT man, Liam.
Liam, do you want to introduce yourself?
Yeah, I'm here to support Joe, just with the IT side of things, and I'm the comms and engagement manager for the training hub.
Thanks, guys. So I'll reshare my screen again, and then we'll get back to the presentation. So I'm not sure if anybody is aware of what we do within the Greater Manchester Training Hub. So I'm just going to play this next video, and it will hopefully. Can we play the video in this section, Liam?
Yeah, I'll do it on my end. I can just, I've got it ready.
Well, thank you.
Health Education England's training hubs are integral to our core purpose of helping deliver excellent healthcare through education and training to our current and future workforce, meeting the priorities outlined in the NHS long-term plan. They are based in primary and community care to serve the local community. By focusing on healthcare priorities, training hubs, in partnership with other educational providers, such as universities and primary care schools, will facilitate or provide training and professional development opportunities for the workforce of today and of the future. Training hubs work with key stakeholders such as primary care networks, sustainability and transformation partnerships, STPs, and integrated care systems to enable educational transformation that is right for the local area. Training Hub's core role is to increase placements by working with educational providers to ensure there are quality learning environments, facilitate student placements in primary care, such as GP practices, to allow learners to gain more exposure and experience, support the promotion of primary care as a great place to work at all stages of career development from school onwards, act as a single point of contact for workforce education initiatives in the area, making it easier for individuals to access information regarding education and training. Work with NHS England and NHS Improvement to help retain staff throughout their career from start to finish, for example, through the fellowship programmes. So how can training hubs benefit you? They enable and facilitate new and existing roles in primary care as part of a multidisciplinary team, to include roles such as physician associate, nurse, social prescribing link worker, and clinical pharmacist. They can help to facilitate training clinical staff to supervise or mentor students on placements. They support the development of the multidisciplinary team, and they support the facilitation of CPD of the workforce working in primary care. You can work with your training hub to identify opportunities to upskill, which will ultimately benefit the care your patients receive. For more information, please visit www.hee.nhs.uk/our-work/training hubs.
Perfect. Have you managed, have we still got my screen sharing, yeah?
I think you have to reshare. I did take over.
Hold on, let's have a look. Yeah, is that back sharing again?
Yeah.
Perfect. So the main focus behind the current guidelines which have changed is the Nmc Code of Conduct. Within the code, it's making each individual pillar centred to be more patient-centred care and delivering that across the board. So you've got the learning culture pillar, which is prioritising safety and valuing learning. Educational governance and quality, students' learning and empowerment. So it's about supporting and enabling the students' achievements and under the outcomes of the NMC proficiencies. The educator and assessors, which is the new guidelines which we will be focusing on today, and the curriculum and the assessment to ensure that the students are fit for practice as soon as they've qualified at the end of their training. The NMC Standards for Education and Training, the guidelines changed in 2018, which a lot of practitioners out there, they know it's changed, but they don't know how it's really affected them in practice. So it's about breaking it down into key elements and how it will affect your practice in future. So it's under the Standards of Education and Training. You've got Part 1, which is the Standards Framework for Nursing and Midwifery Education. You've got Part 2, where it's the standards for student supervision and assessment, and then Part 3 is the individual programme standards, which also we do cover some of that as well, because we cover under the prescribing and the nursing associates, as well as the returning to practice within the GMTH training hub. So the prescribing sector, that has also been broken down into 10 different pillars again. So under each programme, you will have proficiencies within that programme to achieve. So that can go from anything from assessing the patient to prescribing, to shared prescribing, to re-evaluating that patient input and care. And the nursing associate framework consists of 6 different platforms, and it's about them being accountable professionals, promoting the health and prevention of ill health, provide and monitor care, working with the team, improving safety and quality of care, and contributing to integrated care. But for today, we are going to be looking at what we class as the SSSA training, which is the standards for student supervision and assessment. And this is what's broken down into the new NMC guidelines. So the key facts that have changed from the NMC updated guidelines is it used to be the mentor and the mentorship programme, which you used to go to university for and have the accreditation, but now that's totally changed. So there's nothing as like a mentor and a mentorship anymore. You don't have to go to university. It is literally completing the SSSA training with ourselves and becoming a practice assessor and a practice supervisor in practice. They're the main key professionals that will work with the student as well as the academic supervisor, and they will be the people who the students go to if there's any worries or any problems. The old guidelines used to be that the learner had to be at least with their mentor for 40% of their placement. Well, that is totally changed as well. So there's no time frame or percentage. However, we do recommend for the learners to spend some time with the PA or the PS, which we would recommend 1 day a week over the placement timetable. And it's more of a multidisciplinary approach now. So it's about working with other professionals within your practice area, so that the student has a more overall learning experience from their placement. The paperwork, it used to be a yearly update from the mentorship. So you used to always come on mentorship update programs. That's totally changed now. So it's a self-declaration form which you complete on the PAR system, and that's it. If you are satisfied to become a practice assessor or a practice supervisor. However, we do recommend you to keep up to date, so ensuring that you do have students and having the clinical supervision and the reflection time, so that you can have so you can keep up to date with your learning as well. The paperwork, it used to be the gold-plated document where the students wouldn't ever leave the documentation with you, but now it's more accessible, which is on par. So that the PA and the PS and anybody else who wants to leave a reflection for the student, they can access that at any time and from anywhere. It was insignificant clarity around the technical skills at the point of registration, but now, because it's a more multidisciplinary approach, it's more that their technical skills are, and the registrant feels more comfortable and confident within their ability at the point of registration. There was a hell of a lot of issues regarding failing to fail, which now, by using the multidisciplinary approach, it gives that more overall understanding and evidence to why you want to fail a student, or if a student you feel who you've worked with doesn't meet that criteria, but the mentor did. So it's about having that failing to fail and feeling more confident in your decision making. There wasn't future orientated, and the narrowed experience, which limited their experience at the point of registration as well. So like I said, the multidisciplinary within the PCN, within your GP practice, within hospital-based, wherever it is, using that multidisciplinary professional approach, the students will feel more confident at registration. So the difference between a PA and the PS, the practice assessor is the role model who facilitates the learning for the student, also supervises and supports and provides feedback to the student, and contributes to the assessment, progress, decision making, and raises any concerns and responds to competencies and conducts concerns. It is more that the practice assessor is more of the person who facilitates most of the learning, as the PA, which is the practice assessor, which is really classed as the old sign-off mentor. It is where everybody feeds back to the practice assessor. So it's all the multidisciplinary professionals all feed back to the practice assessor, and it's down to them to make that decision at the end of their placement. They confirm the achievements in practice, and they make and record any assessments of achievement, proficiencies and conduct based on multi-resources of evidence. They also communicate with the practice assessor and anybody who's actually worked with that student, just to get feedback from them professionals. And they also have discussion with university, the link lecturer, the PEFs themselves, if there's any worries or any concerns regarding that student as well. And the practice academic assessor collates all the information and confirms that the student has passed that assessment, along with their university work as well. And that's basically the team. They do also have a nominated person, which we would highly recommend. That nominated person, it could be one of us as the PEFs who's linked to your practice. So it's an independent person who can make decisions, who can influence on the process through the placement. So the importance of being a PA and a PS. So it's a chance to teach best practice, keeps the PA, PS knowledge up to date and skills up to date. It's empowering and rewards practitioners and practitioners, helps to develop primary care future workforce, improves patient-centred approach and improves patient outcome. Self-development of leadership and management skills, sharing learning opportunities and developing the CPD of yourself. And under the NMC guidelines, it underpins students receive high quality fundamental learning opportunities that underpins the nursing role. So the barriers. So as placement organisers, we do come across quite a lot of barriers out there, and it's understandable with the pressures within primary care especially. So this is just a couple of slides just to how you overcome these areas of concern. So we get a lot regarding the time to supervise, the time to complete paperwork, the time to organise. So under the new guidelines, the PAPS doesn't have to spend the 40% of the time. So like we've said, like I've just said, probably 1 day a week just to reassess what they've done in that week and what achievements they've made over that week and any competencies that they've completed. So it's about using the multidisciplinary approach, teamwork, and getting students to work across the board, whether that's from the admin staff to the practice managers, looking at it from a broad spectrum so that they know exactly what actually goes off in a daily life of general practice. Minimal paperwork to be completed, so once you've got your signature, it's just a matter of pressing a button to sign that competency off for the student, but also 3 interviews which you will have to sit with the student and complete, which is the initial interview, the midpoint interview and the final interview, just to make sure that the students have completed their placement. There's an extra pair of hands in clinic and within the multidisciplinary team. Getting patients to come in, doing a blood pressure clinic, a weight management clinic, anything like that they can support with is fantastic. Once students have completed their theory in university, they can also do phlebotomy in the 3rd year. So we're encouraging 3rd year students to come out into general practice as well. Students aware of the PAR documentation, and they will come to you and say, can you just complete this for me? I have completed this and I have met that competency in practice. Sharing clinical skills, knowledge and policies within primary care and becoming a role model for our future nurse workforce. GP nurses, they might only work part-time, or there might be only 1 GP nurse within that practice if they're phoning sick, anything like that, which can also impact. So again, only have to work with that patient, that student once a week. If it's a PCN, you could link up with the PCN, other practices within that service, just to use them and utilise them in different areas. If they've got any care homes, what the GP nurse links with, they could have days spent with them, just to understand the social side, social care part of nursing. And like I said, the multidisciplinary approach. You can also have the PEF team or the clinical educators to support with the PA and PS with timetable and etc. So like currently at the minute, I'm doing project work with 3 students that are out every Thursday, so that you could utilise us as well. Contact details for sport placement. So we've found that if you have a good induction day with the student and you've got the information for sports and their contact details, let them manage their own placement timetable, get them exposed to different professionals as much as possible. Extra pair of hands, and also they can do reflective time, a project time. So we were thinking in future, if you're getting a student, ask them to write a diary of their placement. So any key professionals that they went to, what days they worked, if they're out in, you've got health visitors doing baby clinics, what day they do and what they found useful, and then you could just pass it on to the next student so that they've got something to look at when they come to that placement for the first time. Tariff and funding. Yes, we do have different tariffs for different students, but this can go to the individual practice or the PCN. The Greater Manchester Training Hub are not a profitable training hub, so therefore the PCN or the practice receive full tariff of the student. A student nurse gets £82.84 a week. A physician associate, I never can say that, PAs, they get £510 per week, and student paramedics get £94.96, and the counsellors are currently to be confirmed. But we also have funded training for existing staff, so also for your CPD as well. So yeah, so it's a difficult time regarding the funding, but it's something that we can discuss if you were ever thinking about coming a clinical learning environment. No experience on PAR. So you've got the PEF team or the clinical educators who can also support you within PAR and reevaluate. We're wanting to reevaluate this with university because sometimes it can be quite difficult. But like I say, you can use us as a support network. It's computer based, so you have access to this anywhere you want to, or when the students are not even working with you that day and they're out on sport placements, you still can access their PAR document. If there's any problems, then you've got the PEF team and the clinical educators to support you all the way through placement. And learners also have the teaching sessions in university, so they're fully aware of where the PA and the PS needs to document within their PAR document. Lots of organising is another barrier. Again, use us as much as you can, just so that we can help you organise timetables, placements, inductions. We also provide an induction for the students that are coming out into practice from the PEF team, so they've got our contact details, they've got a face to the name, so that they feel confident that they can use us as a support network as well. Using a good induction day at the very beginning of their placement also gives them the quality placement as well, because they've got the access to the spokes, the contact details, the email addresses, so that they can be managing their own timetables. So that's something less for you to worry about. What GMTH offer to support? So GMTH is a non-profitable training hub, therefore all tariff goes directly straight to the clinical learning environment. Some funding is better than none at all, so we always encourage as much to what capacity you can possibly do, which would be absolutely fantastic. We offer funding training for existing workforce as part of continuous professional development. Locality practice education facilitators to support clinical learning environments and students throughout the whole year. You have one-to-one support via face-to-face Microsoft Teams, emails or telephone to support from the PEF team or the clinical educators. So if there's any questions, then we are more than happy to support wherever we can. Additional support with timetables, link work with other practices within the PCN to support possible sport placements, project work, etc. Support to maintain the SSSA training and PAR. So it might be that you've not had a student for a year. We always recommend to try and have a student every year. And if you haven't had a student, then we can support you keeping up to date with the SSSA training and PAR, just to give you a bit of a refresher. Developing our future workforce and the curriculum, working with HHEs and HEIs. So this is just a benefit for becoming a clinical learning environment. So it's the students' expectations. So what you tend to find in year one, it's more of an observation placement. It's about them getting the confidence, shadowing the roles within primary care, gaining confidence with patients and their care and what's expected. Understanding the patient-centred approach and unfolding the Nmc Code of Conduct in regards to dignity, respect, effective communication, documentation, and it's just an extra pair of hands just for that clinical support. In part two, you tend to go for more, they've taken a bit of a more leading role. So mastering the aseptic technique, understanding the protocols and procedures used in primary care. They can be supported within the vaccination centres, flu clinics, weight and management, support with documentation, medication, taking patients' details, anything like that. It's just giving them that extra exposure and experience within their training. And then the third year tends to be more of a independent working, so it's more about their taking that leading role. It's kind of the management year, so it's about the leadership, the management role, completing the phlebotomy training so that they can do that out in practice, supporting and engaging within the multidisciplinary team and in meetings, and more of a mental health. They can assess more mental health at an extra level. So this is just quick overview of some possible timetables for students out in practice. So it's about getting as much spoke, as much experience, much flexion time, along with working with your PA and PS, which we would recommend once a week. Social prescribing, physio and associates, anything like that, what you could get students out on. So that's based on a 5-week placement. The second year, which is a bit more independent, so it's about the management, weight and management clinic, vaccination e-learning, and then they can go to the vaccination centres. Other GPs within the NMC and PCN, sorry, and reflection time, so that they can use that to pass on to students coming into the next placement. And then more independent working, so things like home visiting, they could possibly do home visiting on their own from routine care visits. So it's about you as a PA or a PS to make sure that you do that risk assessment, and if you feel comfortable that it's just about going out and speaking about diet, exercise, anything like that, then that's where they can go out and do them own assessments by themselves. Working with the admin staff, maybe putting them on the front line, so it's about putting them as the main person in admin and trying to manage the front desk, which can be quite difficult. So then these are the different steps. So you've got your guided participation in care in year 1, and then part 2, you've got your active participation in care with minimal guidance. And then part 3 is practicing independently with minimal supervision and the care within confidence. So that's how you know the different steps for each student. However, you might have students who have used to work in care homes, so they might be a lot more confident than somebody who's never had any caring experience. So it's about using your assessment at the beginning just to see where they are within their learning. So the synergy model, we know it's out there. We know it's difficult to maintain within primary care, but we just wanted you to know that we do know it's there, and we try and use it as much as possible. So where we focus on this is about the coaching and the multidisciplinary approach. So using your coaching skills to facilitate facilitate them in the multidisciplinary team, and it's about using them other professionals and learning off them and learning from each other. So you might have a 3rd year last placement in practice, but then you might also have a 1st year first placement. So that's about peer-to-peer support across the board as well. So using the staff that you've got and utilising them as much as possible. And this is again the same, so it's just about learning off of each other, and it's the model what's out there for synergy, but also using the coaching techniques just so that you can use that in practice as well. So what's next? So if you wanted to become a clinical learning environment, then what we do is we sign a form, which Liam, I don't know if Liam can share this in this forum, but it's basically just for you to give us consent to contact you following this this meeting. and it's about completing the full GMTH clinical learning environment audit. If there is any professionals on here who's currently doing the GP nurse foundation course, then also a GMTH clinical learning environment audit needs to be completed, just because it's in their terms and conditions of signing up to be a GP nurse. So it's about us supporting you with that from a PEF point of view, and additional support wherever you needed. The university then completes and signs off your learning environment audit, and the university then will add you onto the PAR. And then the learning environment to start taking students. So wherever you feel that you're confident to do that, or you're in a position to do that, then we will work with you to try and support you as much as possible. And then the tariff will be sorted from the GMTH point of view, and the clinical learning environment will start to receive the full tariff. So we've put here any questions, and I know it's difficult, I think, within this because I'm not very good with IT, so bear with me.
So there's one question in the chat, Jo,
Yeah.
around does the practice get paid for being a learning environment?
So you get paid per student. So whichever student you have, whether that's a student nurse, a physio, a paramedic, you will get that tariff for that student, and that tariff will come with you for as long as that placement is. So we have placements from 5 weeks to 15 weeks. The 15 weeks ones tend to be the management placement, so it's any time between 9 and 15 on the third year student, but that tariff will come for the exact amount of time that student's there. If you've got a spoke, then the spoke placement will not get any tariff. It's only where the main hub is, that'll get the tariff. But there is some situations where you've got social care, so you might have a nursing home what's near the GP. So what they might do is have 3 weeks in the nursing home and 3 weeks in the GP practice to share that one student, and then that'll just get split equally between them two organisations.
Thanks, Jo. And I think then there's another question around are the students with the practice for 5 days a week for 5 weeks?
Yes, so it tends to be full time. It's full time, and then it's for however long that practice. So like I've just said, if it tends to be a first year, second year, it's anything between a 3-week placement and a 6-week placement, and then the third years are anything between a 9-week placement and a 15-week placement.
Yeah, and just to be clear around that, what that means is they don't physically have to be with you for the 5 days a week for the 5 weeks. They could be out and about with any of your other members of your PCN, your practice, or even doing some project work. Yeah.
Admin staff, which is really good. Practice manager, if they are looking at it from more of a business point of view, anything like that is good exposure.
And then there's another comment around we need to liaise with our practice nurses to ensure they're happy to accept students. I think we're wholeheartedly 100% banging that drum, definitely. It needs to be kind of nurse led for me. It always has been that this is about us kind of bolstering our future, isn't it? And enriching our own practice. I love having learners with me. Me personally, I think it just adds a bit of extra interest to the day. So absolutely. And if you can think of any other ways that we can communicate with those practice nurses out there in practice, drop it in the chat, put a comment on our website, or get in touch with us to make direct comms.
Yeah. If there's any questions following this, just put it on the chat, and then if we don't get time to answer them, then we can email you following the meeting today.
Yeah, I think we've got 4 minutes left. We've got a 4-minute warning. So we have got a list of things that they can and can't do. We've got loads of information that we can send out to you all around frequently asked questions. As far as I'm aware, the specialist practitioner is still available, but that is not directly through us. You need to contact one of the local universities and have a look on their website to see who's running that. The practice would get the funding, Christine. It would go to the practice. because they would be the clinical learning environment. And we can definitely share the slides, can't we, Jo?
Yeah, of course we can, yeah. But just think we're always here. So if there's anything that you've got any questions, any queries, anything that something's not worked out, even though it might not be in my area, I don't mind, email me and then I can put you out to the PEF so that they can deal with that in whichever area across Greater Manchester you are at.
Yeah, and I think we have learners coming out all across the year, and we really encourage that kind of diverse cross-pollination so that we've got everyone out there in our wider teams that understand our specialist role. We still should have that specialist title, I think, as practice nurses. There is no other role in nursing that I think is so involved and is so autonomous. Our skill mix is vast. And if anybody would like, on the back of today, would like to take a student or be interested in being a spoken, just dip your toe in the water, get in touch with either Jo, myself, Liam. We've got a wave of third-year students coming out at the end of April and into May, where we're really starting to raise the profile of general practice. Pre-COVID, we had really good footing within the HEI programmes of education, and we had a really good input into our practices. COVID has we've gone back in time. We've unfortunately given the message that general practice isn't the place to be, and apparently we're shut, I believe. So it's how we can get that message out there that actually we are open. We have got this really diverse, rich learning environment that is an amazing opportunity. So help us fly the flag. It's actually call to action.
I had a feedback from a student the other day and she was like, oh, I was so run off my feet and I can't believe it, and I didn't realise it was going to be like this in primary care. And they just and students don't, because it's not brought up and it's not exposed enough, is it, Sam, in university? It's not talked about as much as what secondary care is. So, yeah, we're flying the flag very high.
Yeah. And that's great. We just got a comment from one of our active PAs and PSs in practice, who's also happy to share learning experience too. So that's fantastic.